Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Democratic Senator Jon Erpenbach is seeking re-election in the 27th Senate District. He's a Democrat. John, welcome back to WisconsinEye.
Thank you. It's good to be here.
I ask incumbent legislators if you're back, top priority in the next session.
There's a couple of them, and it's one we've been trying to work on for a while now. Transportation funding, a consistent source of revenue, is extremely important. Steve, it's been like 12 years since we've increased the gas tax or even talked about it or looked at it. And people who drive on our roads, especially our county roads and our state highway roads, not the interstate system, but the state highway roads, are a mess. And so finding a fair way to make sure that we pay for not only what we have and that we're able to maintain what we have, but build new roads where it's necessary, I think that has to be a priority for anybody, whether you're a Democrat or a Republican. We all drive on the roads, you know, and you can't say that we're open for business when our roads are bad.
Does that include a little bit of everything? Gas tax upper, registration fee upper? What about tolling?
Here's the issue I've always had with tolling. You know, it sounds really good that the people who use the roads are paying for them and so on. But other states have turned around and sold the tolling rights and grabbed some quick cash, and then all of a sudden we don't have control over our roads anymore. So I don't think tolling is necessarily the best idea, okay. But it has to be fair. No matter how you look at it, it has to be fair.
So you could vote gas tax upper, registration fee upper?
Possibly. Again, it depends on what if it's going to be a large mix, we have to see what it's going to be.
Yeah.
But I think all sides know, and I know I'm working with some Republicans on joint finance in this last two budget cycles. We had some pretty serious talk about what's the best bipartisan way to deal with transportation. And then obviously the political pressures upon them to basically just stop talking about it were stronger than actually trying to get something done. And then the other issue obviously is K-12 funding and making sure that we get our UW system back to where it is financially and our technical school system, college system, back to where it should be financially.
The current budget was a big bump in state aid for K-12. Mm-hmm. You advocating another similar big bump in the next 2 years?
Absolutely, yeah. Because again, if our job is to make sure that we give kids, no matter where they live, opportunity to excel at whatever it is they choose to do, we need to put our money where our mouth is, and we have to try and take some of the constraints off of local units of government, meaning school boards, and let them do the job that they are elected to do and make sure that the funding is there and more importantly that it's fair. And it's not just funding, Steve, it's also access to broadband no matter where you happen to live. You know, if you have a kid who's on a school bus and they can do their homework because there's Wi-Fi in the school bus, the second they get off the bus, they can't do their homework because they don't have access to broadband. So again, it shouldn't matter where kids live in this state. Opportunity has to be the same, opportunity has to be there, and that costs money.
And you mentioned the UW. Not a fan of continuing the tuition freeze?
No, not unless it's going to be funded. I mean, it sounds tough. We're going to freeze tuition. There's a couple of things on that. First of all, if you're going to freeze tuition, fine. You have to make sure that you backfill the freeze. In other words, that we should be paying for it, first of all. And then secondly, if you're serious about the high cost of tuition, take a look at student loan debt. Come up with a way to make sure that that students with debt can refinance. And do so in a way that they can afford to pay for it. And then economically, on the flip side, what that means for the state is that frees up more disposable income for people who have it all tied up in student loans right now. So yeah, you know, you can freeze tuition, but you have to pay for it, and then you also have to try and come up with something when it comes to student loan debt. It's a killer for a lot of people.
Your district has been hard hit by flooding. Mm-hmm. Much of the impact is borne by local governments. Local governments have been dealing with levy limits for 13, 14 mm-hmm. years. Is it time to get rid of those levy limits, loosen them, or keep them?
Well, it's not just levy limits. It's, you know, it's a situation in Middleton right now where you build a shopping center, a couple of hotels, and it's all nice over there, but you kind of built it in a marshy area and then you pave over. You know, there really isn't any place for the water to go. So that possibly not being an engineer, but to me that kind of strikes the idea that was kind of our fault. That it wasn't done properly. But at the same time, when a local unit of government comes into a situation and there's not really any flexibility in cost controls at the local level, and things like this come up where there's serious flooding, they are not at liberty to basically go out and get what they need in order to put their town back together. And the flooding basically right down Highway 14, Middleton, Cross Plains, Black Earth, Mazo. I think collectively Mazo probably got hit the worst as a community. They need to be able to respond immediately in these types of situations, and rather than have politicians go out there and say, yeah, boy, I'm going to tour and this is tough, this is bad. Let local governments govern themselves, and if they feel they need to go out and raise some money to fix something, they should be able to do that.
Kimberly-Clark's given the Senate till September 30th to enact Foxconn-like tax breaks, tax benefits. I don't think I'm going out on a limb here saying you'd vote no. Why would you vote no on a Kimberly-Clark package?
I'm not necessarily saying how I'm going to vote. First of all, I think it's an artificial deadline. I think anytime a corporation comes to the state and tells the taxpayers, we're going to give you till September 30th or we're going to whatever, I mean, to me, that's not necessarily bargaining in good faith. But secondly, ever since Foxconn happened, I am not shocked Kimberly-Clark is doing that. I don't blame them. This is what corporations do. It's one of those things where it's like, well, Foxconn got this, I want that. I mean, and I don't blame them. At the same time, the Republicans control the agenda. They control what we vote on. They control every single piece of legislation without hardly any input, if any input at all, from Democrats. So for Kimberly-Clark to come and say that we need Democrats to vote for this, and Roger Roth to say we need Democrats to vote for this, they have the majority.
Governor Walker to say that too.
What?
And Governor Walker to say that too.
Yeah, you know, okay, you want us to vote on something that we didn't have any say in? That's going to be pretty difficult. That's a big ask. And so in the end, Kimberly-Clark, I don't know. I don't even know if we're going to have a vote on it.
But you voted against the Foxconn
Yes.
incentives. You don't think it's wise public policy.
No.
So you.
But it's not wise public policy on a couple of fronts. It wasn't just the money. The money giveaway to me was just horrendous. It's first draw off the budget, Steve. And we're talking hundreds of millions of dollars out the door before we basically pay for anything else. Environmentally, Foxconn is not sound. And in the long run, even in the short term on some things, could do some very serious harm to the environment. And just the idea that there's no accountability whatsoever when it comes to what taxpayers are being responsible for. And when they say they're not getting any tax breaks unless they create a job, that's partially true. We're still giving them $1.5 billion to go toward their construction costs. So it's one of those things. When the legislation came through and we had the hearing on it, they couldn't answer basic questions on the environment. How many gallons of water a day are they going to be using? We know now, but they couldn't tell us then. So again, to not have any input or any oversight on this type of legislation, and then for the governor or any Republican to say we need Democrats to support this, it's foolish. It's just foolish.
Let's turn to healthcare. How do we protect and maybe expand healthcare in the rural areas, John?
Well, first of all, you stop these stupid lawsuits that the Attorney General and the governor supports. The idea of people campaigning on taking something away from someone, I've never understood that. And it doesn't matter if you want to call it the Affordable Care Act or you want to call it Obamacare. There are things built within this that allow states to tailor it to what they need, whether it is their own exchanges, whether it's taking the Medicaid expansion, which the governor refuses to do, to lower the costs in other areas. Just the idea of someone going to bed at night in this state wondering how they're going to pay their medical bills for a condition that they didn't choose, that they just happen to have based on family history or whatever, should keep all politicians up at night. Pre-existing conditions, insurance companies are always obviously trying to find ways around pre-existing conditions, and for the governor or the Attorney General to support a lawsuit that basically dismantles the Affordable Care Act and takes away coverage for pre-existing conditions is a massive step backwards. If anything, we should be able to make sure that we have the law here, we know what we can do with it. Let's make it better for Wisconsinites no matter where they live, and make sure they have access to affordable, high-quality health care.
State government have a obligation to recruit and retain physicians, nurses, and other medical professionals?
Yeah, we do. But at the same time, when you're dealing with quality of life issues that aren't where they used to be here in the state of Wisconsin, whether it is really good K-12 education opportunities no matter where you are, a highly ranked university system which continues to slide a little bit based on cuts that the state has done over time, when you don't have as strong environmental regulations and as clean as an environment that we used to have here in the state, just the overall quality of life takes a hit. It makes it harder to not only recruit those in the healthcare industry, but retain what we already have. So Yeah, and it's not just the idea of go to rural Wisconsin, we'll help you out, and so on and so forth. It has to be a quality of life that people are looking for, more so than above any other type of break they may get. It's all about quality of life, and it's not like it used to be here in Wisconsin.
State government and Delta Dental have a program that subsidizes dental clinics in low-income areas. Should that be a priority in the next MA budget?
I think so, and I think the dentists, overall, the Dental Association has done a great job with the clinics around the state, and the idea that they see as many patients as they do when they take the buses or whatever it is out into areas where people actually happen to be. Dental care is extremely important. I remember when we were growing up, you go to the dentist and you get your cavities filled, but we didn't necessarily see the connection between overall health and good dental hygiene as we do today. So access to dental care is extremely important. We've increased Medicaid reimbursement rates for those in the dental community. Maybe we need to do it again. We can't do it unless we take the expansion of Medicaid. But yeah, we should definitely be looking at that.
According to AARP, 578,000 Wisconsin residents act as caregivers. Here's my question. Would you support laws or regulations that require hospitals to recognize and work with family caregivers when those they love are hospitalized?
I guess I don't understand what you would.
AARP would like laws or regulations saying if you're a caregiver,
right,
maybe not even a family member, and someone you love is admitted to the hospital, you have to be given information and recognized more.
Oh, if you're not like an immediate family member?
Yes.
Yeah,
yes.
Because there are situations right now where, although the hospitals do a pretty good job with that and making sure that if someone is receiving care in a hospital, that it's not just the immediate family that can get in to see that person. If I'm getting the care and I say, yeah, my friend, so on and so forth, they can come in. But I think you're looking at situations possibly where there isn't the official marriage involved with two individuals, yet they've been lifelong partners. And so the idea of making sure that they have access and are informed when care is being given to their partner, yeah, absolutely, it's important.
Some of the 8 Democratic candidates for governor said we could cut the prison population in half. Are you one of them? If so, how? Number 2, do we need a new state prison?
No, we don't need a new state prison. If you can cut it in half, I don't know. I haven't looked at the numbers that closely. I can tell you that there are non-violent, addicted, related people in prison right now who shouldn't be. It's extremely expensive to treat someone's illness that way. It's a stupid thing to do. You can't even begin to make restitution if restitution is part of your sentence if you're sitting in prison for a non-violent, drug-related offense, embezzlement-related offense, whatever the case may be. We understand that there is consequences that have to come when someone breaks the law, but there are smarter, more cost-effective ways to deal with this and also making the victims whole. There are better ways to deal with this. So yeah, we don't need a new prison, first of all. Secondly, there are thousands of people in jail or in prison right now who shouldn't be simply because they are addicted to something. And you remember back in the day when we did the truth in sentencing and all of that stuff, which was a big boom for the those within the prison construction industry. But just because we have that many prisons doesn't mean we need to have that many people in prison.
Part of this issue travels with the idea of, do you support legalizing either medical or recreational marijuana?
Medical, absolutely. In fact, I've introduced legislation, I don't know how many years now, to deal with the use of medical marijuana with the prescription from a doctor. Whether or not we have full legalization, I tend to think that that's one of the few issues that everybody in the state should have a say on. So if you do a statewide binding referendum on it, I wouldn't have any problem supporting it. Okay. So again, it's one of those things where I respect those in the medical community and those within the addiction areas of life that say marijuana is possibly a gateway drug, and it might be for some individuals, but it's not for other individuals. And I do know enough people from all walks of life, from all ages, who have used marijuana or know someone in their family who has used marijuana, whether they were getting chemo treatment, whether they're dealing with debilitating diseases, chronic pain, whatever, and it's helped them. So who am I to say, no, sorry, you can't have that? when it works for them, and why make them go out and break the law to get what they need to make their life a little bit more comfortable.
And the last question, do you want to highlight differences between you and your opponent on November 6th?
I don't really know my opponent and where he stands on any particular issues. I just know that if people want to know where I stand on an issue, I'm extremely approachable. They can always call the office, get stopped on the streets all the time. We've been doing listening sessions every single year in pretty much every community in the state Senate district that I represent. But just the idea that I am open to make sure that whatever we are doing in the state Senate and the state of Wisconsin as a whole is for the betterment and of the state and the people who live here, and making sure that especially the kids have opportunities that I didn't have when I was growing up.
Thank you. Democratic Senator Jon Erpenbach of Middleton is seeking re-election in the 27th Senate District. The election is November 6th. Jon, thanks for sharing with WisconsinEye.
Thanks.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.